when it comes to health and fitness, I think that everything matters. Right now, everybody's talking about zone 2, VO2 max, how much muscle you should use, how much muscle you should put on your body to get stronger, to live longer. There's one conversation that nobody seems to be having, and it's about dental health. Yes, you heard it right. I said dental health, not mental health. So I've been discovering that your dental health can impact on your health, your fitness, and your longevity. And I have with me today a good friend of mine. I'll call her a friend. She might say otherwise. Dr. Amanda Storey, who is a dentist, who is actually my dentist. And I've been thinking about doing this for a while because of my own personal journey with my dental hygiene. Quick story, when I went to Amanda at first, my mouth was a mess, lots of gum disease. And I've spent maybe 2 years now with you, Amanda, gradually fixing everything. And my last visit, I'd like to say there was no bleeding. Shout out to Peggy, my dental hygienist. So I want to bring this conversation to the fore a little bit because I don't think anyone's really given it much attention. So I'd like to introduce Dr. Amanda Storey. She's been my dentist for a long time. She's got a practice here in Barbados. And we want to talk a little bit today about how your dental health can impact on your fitness, your performance, and your longevity. Hi, Amanda.
Good morning, George.
How are you?
I'm good, thank you.
Good. So we're gonna let everybody know that you're a little bit nervous. This is your first podcast, but
You think so?
we're just friends here having a conversation. So let's start with gum disease because that's where I was when I came to you. How can gum disease impact on somebody's health, fitness, and performance?
Well, there's a lot of evidence out there to suggest that gum disease does impact your overall health, specifically your cardiovascular system. So therefore, if it impacts the cardiovascular system, it must impact on your physical health.
So when you say it impacts your cardiovascular system, in what way?
I think that the thought is that because periodontal disease is an inflammatory condition, then you will have a level of inflammation within the body. So that produces like inflammatory mediators, and that then impacts on your cardiovascular system, specifically the blood vessels.
So what I'm hearing is that it generally increases the inflammatory response in your body,
That's right.
and increasing the inflammation then is where we get the increased coronary artery disease risk for your heart.
Yes, that's right.
Right. Okay. So what can the average person do to start to mediate that?
Just by paying more attention to your oral health. I think one of the things that people don't seem to be aware of is that they do have primary control of their oral health. This is not the dentist that has control. Our job is to educate. Our job is to provide solutions, in some case intervene. But generally people have more control over their own oral health, specifically the obvious thing with toothbrushing, but also finding some interdental means that works for them to clean those areas that are not accessible with the toothbrush.
Right. I'm glad you mentioned that because I always thought I was brushing really well.
Yes.
But the interdental means,
And that's really important.
and that's the flossing, I'm taking it.
And it's not just flossing. There are several other aids that can do maybe not quite the same thing. Flossing targets specific areas like where the teeth make contact with each other, but there are areas that will target the interproximal areas, so the areas underneath the area that the teeth contact.
Okay.
And unfortunately, most people seem to struggle with flossing,
Right.
whereas the other techniques are simpler.
Okay.
So in my experience, I find I get more compliance with other techniques rather than flossing.
Like what, for example?
You mean what are the other
What the other
aids?
techniques? Yeah.
So they're what we call proxa brushes, there are soft picks, there are interdental sticks, anything that will physically pass through the spaces that lie between your teeth. So they will physically remove the plaque, and the plaque is what harbors the bacteria.
Right.
And the bacteria is the problem, is what induces the inflammatory response, hence the connection with inflammation in the rest of your body.
Right. What about a toothpick?
But toothpicks generally don't have the right shape to do that. So toothpicks might be good just for removing gross food. Like water picks might be good for removing food, but you need something physically to contact the two surfaces to remove plaque, because plaque is very adherent. So in some senses, it's quite difficult to remove. So it has to be something physical.
Right. And what I learned from you is that there's a 24-hour cycle.
So ideally, you should every 24 hours remove that plaque.
Right. So make it a part of your routine. Go just before you go to bed at night. Don't just brush and get into bed and hurry.
It can be any time. I
Right,
think
okay.
sometimes that the night times are the worst time because people are tired.
Right.
So it's easy to postpone until the next day, and the
Right.
next day never comes.
Got it.
So it could be any time.
Okay. All right. So far, I think that's already useful, because I think most people kind of like brush their teeth and they're more concerned with the kind of aesthetic appearance, right? If they smile in the mirror, the teeth look white, they feel good going out there to face the world. They do a little, and if it smells okay, they feel like they're good. But what you're telling me is that it needs more than that. It needs a pretty consistent, regular routine, getting in between the teeth and close to or underneath the gum. I'm hearing.
The floss will go underneath the gum.
Right.
The other aids don't generally.
Right. To make sure that we're clearing that bacteria on a regular basis, because otherwise it starts to build up in the plaque, and that's where the increased risk starts to come about.
Exactly.
Okay. So with athletes, people in the gym, we see a lot of time, we see people grinding their teeth,
You mean
especially
clenching?
on clenching, yeah, and grinding their teeth on, well, clenching and maybe, depending on how hard they clench, especially on the strain, you can get a little grinding as well. Is there some sort of risk associated with that?
What you're saying is when they are performing or doing something that they're clenching their teeth together.
The acute and the chronic. So in the moment, is there obviously if they're clenching too hard, there's some sort of risk of grinding.
So your teeth are not designed to take those type of forces. So if you're gritting your teeth or clenching them, you're probably putting excessive forces over a sustained period of time, and your teeth are not designed to take that type of load.
Right.
So
What's going to happen over the long term if I continue?
In the worst case scenario,
Yeah.
you could split them.
Okay.
You could fracture them
Right.
to such an extent that they wouldn't be savable.
Right. Okay. Would that be obvious to me?
If you fractured them,
Yeah.
yes.
Okay. So I mean, I was
might
kind
have
of
pain.
thinking about a scenario where I might have gotten a microfracture, not being aware of it, and then I start to get food or debris starting to fill
Or
it.
you might start to get symptoms where the teeth are tender when you
Right.
put pressure on them when you're eating.
Right. Okay. So let's say I was somebody who clenched and ground my teeth at night. Right. So maybe I'm sleeping and my partner's like, wake up, you're grinding your teeth. What can I mean, I'm asleep, right? So what can I do to get away from that?
So one of the interesting things that's happened maybe over the last 10, 15 years is they've started to explore the connection between patients who have sleep apnea and patients who grind their teeth or clench their teeth, more specifically at night. I think the thought being that it is the patient's attempt to open their airway so that they can breathe better. Because for years, we often don't know why patients, there have been a lot of suggestions in terms, it might be how your teeth relate together, it might be stress. So this one is kind of come about, I would say, relatively recently. What can we do about it? Well, you could go to a sleep apnea clinic, and perhaps having a CPAP machine might relieve that. Botox has been another alternative therapy where they would actually Botox the masseter muscles, which
Right.
raise your jaw. Generally, what we as general dentists would do is provide you some sort of guard
Right.
which would actually stop you making tooth-to-tooth contact. And the other thing the guard does is it prevents the masseters from exerting the same amount of force.
Right.
So the load is reduced. So that is generally what we would do.
Okay.
I did find some research about that recently where they took athletes. Is this okay?
Yeah, absolutely.
They took athletes, like high level athletes, and they made occlusal guards for them, which put their TMJs into an ideal, so what they
Right.
call a centric relation position.
Before we go on, TMJ,
So the TMJ is the
temporal mandibular
temporomandibular
joint.
joint, or you
Uh-huh.
might call your jaw joint.
Right.
And they actually found that their like swim times improved, everything improved about them because they had created this ideal relationship through them wearing this guard.
Right.
And that was, I thought it was interesting. Another one was where stop.
Stick a pin
Yeah.
because that's quite a lot there so far that I want to unpack some of it.
Okay.
Because you just said that there's a relationship between grinding your teeth and sleep apnea. I've never heard that before. And that is huge. That's huge for so many people out there who might be struggling with sleep and trying every other solution under the sun and not even being aware that this could be one of the issues leading to it. So right away we have a fix because we know or a potential fix, I should say.
It may not be true for all cases,
Right.
but it's certainly, I think in many cases, it's something people could explore.
Could explore because, I'm there, I'm doing everything right. I'm eating right. I'm training right. I got my coach giving me my cardiovascular workouts. I'm doing all them and I'm still not quite getting the performance I want. And it's because I'm not sleeping well. And I'm taking my magnesium. I'm doing all the things that people tell you to do. And meanwhile, potentially, it could be that it's the grinding of the teeth that's leading to the sleep apnea.
Or is the sleep apnea leading to the
The
so
sleep apnea
it's
is
it's the other way around.
Oh, right. Okay.
Yeah.
See, so the sleep apnea is leading to the grinding of the teeth because it's kind of your body's kind of trigger to try to get you to breathe,
Get your airway open.
open the airway
Yeah.
so you can incredible. All right. So
Interesting.
very, very interesting. And then we started to talk about the guards and how, because I've seen these things on Instagram.
There's lots of different guards. So
Right.
there's guards that you might buy in the pharmacy.
Right.
But what we would do is we would make guards specifically for you. So
Right.
they have to be done through impressions. They have to be made in specific labs. They have to be adjusted once they're returned and fitted.
Right.
They have to be reviewed. It's not just, I don't think it's such a good idea to just go and buy something out of a pharmacy.
Right.
That would be like a generic thing that any and everybody could use.
Right. And I actually have 2 guards that you made for me when I was doing Brazilian Jiu-Jitsu. and-
Okay, yeah.
Yeah. So you're saying that if I think I have the problem with grinding at
Yeah.
night, I could wear this guard not just when I'm doing BJJ or boxing or whatever as a protective mechanism for my teeth.
That
but
would be different if you
it would
were
be a different
that
guard?
would be a sports guard.
yeah. Okay.
So this one is more specifically like the sports guard. Well, I guess people buy those in the pharmacy, do they?
Oh, the boil and bite ones, you mean?
Yes.
Yeah. But I think you got one done specially for me with my
Yeah, because
with
the same
impression.
lab will make like a sports guard.
Right. Okay. So
So that sports guard is a little different to the one you would wear at night. Sports guard might be more about protecting your teeth and something where there might be impact or whatever, but this one is different.
okay. So I suspect that now my sleep apnea is leading to me grinding my teeth. The steps I should take
Possibly.
is make an appointment with my dentist and tell them. I was watching this podcast. I saw Dr. Storey say that, potentially I might be grinding my teeth because of my sleep apnea. My doctor said I have sleep apnea. So I'm here to get, your advice on how I proceed. This is what we should say, or we're asking specifically for the guard.
So if the doctor diagnosed you with sleep apnea, then they would recommend a CPAP machine. I
Right.
think that's what they do. There are guards as alternative to the CPAP machine, but I think that they could be quite cumbersome.
Right. Yeah, at one point in time, I thought I had sleep apnea
Yeah.
because I snore really loudly. And, but then I went to one doctor, they said yes. The other doctor, they said no. But I was never like, the idea of a CPAP machine never even occurred to me.
So there's a sleep clinic here, I think, where they'll actually record some measures
Right.
while you overnight, and I think that's how you would diagnose it more
Right. I did a
effectively.
48-hour sleep apnea test with my neurologist.
Okay.
By the way, I've done everything I've done everything under the sun to try and fix my sleep problem, but
And you don't have sleep.
it still seems to be there. He said, no, I don't have sleep apnea. Okay, but all right. So staying on topic and getting off me back to the whole topic of dental health for fitness and performance. The clenching is if my teeth don't fit together properly. For example, I don't really know what these things mean, but overbite and all this stuff. If my teeth don't fit together properly, what are the implications of that for performance? You were talking about improved performance amongst these elite athletes when they put these guards in, special guards.
Yeah.
So tell me about that a little bit.
So it would seem from that research that if your teeth are in ideal, in inverted commas, relationship, or if you're more specifically, if this joint is in the ideal position, that these elite athletes would perform better. I think the problem is that there are so many variations in how with people how your teeth fit together, how they work together. And a lot of people function very normally with a non-ideal bite.
Right.
And perhaps in some cases that non-ideal bite will have consequences, and in other cases it won't.
Okay.
So, do we try to set everybody into what we would call a class 1 relationship with the TMJ and the ideal? Is that actually feasible? I don't think so.
Right.
Maybe pathology only presents with in certain instances, but it doesn't necessarily present when somebody is in a non-ideal relationship. Does that make sense?
Yeah. So you're saying, let me see if so you're saying it might be a correlation versus a causation. So elite athletes some of them might perform better when they have this.
And some of them might
Not, right.
because the sample in the study was quite small.
Right. How
It was
many?
only
Do you
like
remember?
10 people.
Okay, right. These small studies, and they tend to be quite homogenous, these groups, right? All the athletes. Okay. So if you had to, for example, give the average person out there listening to this podcast and saying, okay, you know what? I never thought that my dental health could impact how much I'd bench press. I never thought that my dental health could impact my 5K time. I never thought that my dental health could impact my 100-meter sprint time. And you had to give them 2 or 3 very general pointers on how they can start to improve their dental health towards improving their performance. What would you say to them?
Well, I think the basic thing would be how you brush your teeth, your brushing techniques, how effective you are with that, and then finding something that you use with the toothbrush, which will access what we call the interproximal surfaces. That's the basic thing. Keep your mouth clean.
Keep your mouth clean.
Yeah.
Okay, maybe that's the title of this podcast. Keep your mouth clean. Yeah. So, anything that you want that's like come up, and I know you were reading and studying to prepare for this. Is there anything that you saw that was interesting that you think people out there should know about?
I think all of it was interesting for me because it's an approach that I've never looked at this. I've never thought about. I mean, there's a link between oral health and diabetes. The two are, we've known that for years, and now the cardiovascular system. And there is suggested a link between oral health and Alzheimer's, and oral health and premature babies. There's lots of things,
okay.
but specifically your physical performance. I've never looked at this before, so this has been really interesting.
Right. So I'm 50-ish-year-old guy, and I want to run 10.8 seconds for the 100 meters. Apart from just good dental hygiene, is there any hacks or tricks you would recommend around my dental health to get me to perform better?
So if your dental health is at optimum, then so if your dental health is at optimum, then that's not holding you back.
Right.
So everything else is, what you eat or how you train or whatever.
Right. I shouldn't be buying any of these devices I see for sale on Instagram.
Such as?
You see these companies every now and then. Usually companies in the sports areas talking about this thing's going to improve your performance. Wear this thing in your mouth while you're training, and it's going to improve your performance by X%. You think about that?
I can't speak for that. I can't, because the research that I looked at, these guards were very specifically designed,
Right.
you know, and they were adjusted. They
Right.
obviously were done by dental people or the dentist, whatever. They weren't something that you just bought on Instagram. They produced this very specific relationship between the upper and the lower teeth. So I can't speak to that.
Okay. All right. And you're yourself
Probably no.
Probably no. Right. Okay. Because I think I'm going to be buying something that's generic,
Yeah.
and it could probably end up making things worse, I would guess.
Then there's that possibility as well.
Right. Right. Okay. Anything else you want to tell us, Dr. Storey?
Well, I did find that there was some evidence with dental caries, because that would also be bacterial,
Right. Dental caries, is that?
like cavities.
Okay.
And respiratory disease. So I think the thought is that if there's bacteria in the mouth, that bacteria can move anywhere
Right.
via the bloodstream. So it can impact anywhere. And obviously your respiratory system and your physical health are going to be related
Inextricably
similarly to the
Yeah.
cardiovascular system.
I'm glad you raised that, because that triggered something for me. There was a time when everybody out there was saying, take out your mercury fillings, it's leaching into your bloodstream, and it's going to affect you. It's going to get brain fog. You're not going to be able to perform as well, and so on and so forth. How would you respond to somebody who said something like that?
My reason for taking out mercury fillings as you described them is more specific. Well, if I see certain things, then I will recommend that patients take them out. I don't generally take them out because they're there, although some people will ask to have them taken out. I don't know, is there any evidence?
I don't know. Do you think there's any real general risk for people who might? I don't think that people don't tend to do mercury fillings anymore, do they?
Well, I don't.
Right. So somebody my age or older might still have some in.
Yes. Yeah.
But there's no real evidence to suggest that a well done mercury filling is putting you at increased risk.
But people will always find evidence, whether it's credible or not.
Right. Right. Okay.
You know, they're going to stop, or they're trying to stop fluoridation in the water in the US because they say that there's a link with autism. Is that a founded, is that credible evidence?
Right.
I don't know. I think you can always find something that will support your cause. Would I suggest you take out mercury fillings? Well, don't forget, in the taking out of mercury fillings, you are creating an aerosol which has in mercury particles.
Right.
So might it not be in some instances just safer to leave them where they are?
Okay. All right. I think that's quite a lot of information so far. I think for me, anyway, that's been elucidating. I mean, I've learned at least 3 things so far. You want to give us one more point, or you think that?
So one of the other things I noticed in some of the research articles was talking about older patients who had lost teeth over the years. And one thing they noticed was how that impacted on their physical strength.
Right.
And I could ask you this, isn't physical strength almost becomes more important in a sense as we age in terms of not falling or being able to manage stuff? So, I mean, that was interesting as well.
Yeah, physical strength, grip strength, particularly quadricep strength, particularly, they are like kind of the best predictors to not just lifespan, but health span. And you're saying that if I have occlusions, that's why you describe them?
So less teeth.
Right, because they've been extracted or just rotted or whatever.
So they might have been extracted from periodontal disease or caries or whatever. It's almost like the less teeth these older patients had, the less physically able they were in terms of muscular strength. But I think in terms of also physical fitness, if you like, you could say that at that age.
So
obviously then the aim would be like, keep your teeth, look after them.
Well, that's the question I'm going to ask now, because I was at a very young age, I had 2 extractions. Should I be thinking about putting in implants? Should I be thinking about filling that some
sometimes it's how has that space impacted you? How has it impacted the opposing teeth, the adjacent teeth? And sometimes, the treatment may not be necessary.
Okay. How would one decide?
That would be you between you
Right.
and your dentist.
Got it. Got it. Okay. All right. Amanda, thank you so much. You had something else?
No, I just wanted to say that I've actually really enjoyed kind of reading this. It's sort of, it's more information about my profession, and it's just a different approach. And much as I might have been reluctant to do this, thank you. I've enjoyed it.
No, well, thank you, because again, I think
I haven't enjoyed this.
it's worth.
I've enjoyed the reading.
Yeah, it's worth repeating that. I think there is kind of a phenomenon with social media where if something is popular, if something's getting views, if something's getting likes, then you create that same thing. It's basically a copycat medium. But I don't think there's enough people having a conversation around this topic. So I want to thank you for spending the time and doing the work to get the information out there to the audience. And I'm sure there's going to be lots of comments and questions. So maybe as they come in, we can get you back on the show again later on to answer
But
some
I
of
do
those
think that
comments
the
first.
fundamental message is people need to take responsibility for their own oral health.
Yeah.
That sounds simple, doesn't it?
Keep your mouth clean.
There you go.
Okay. Thank you very much, Dr. Storey.
You're welcome, George.